Hi, I'm Kelly for Texas Pediatric Dentistry, and today I'm going to talk about operative appointments or treatment appointments and what to expect if your child has one of those types of appointments at our office. These are the kind of appointments that are for like cavity fillings, extractions, whether that's because there's something wrong with the tooth, or sometimes there's an orthodontic reason that we need to extract the teeth. Those are the types of appointments that we're talking about, and those are the most common ones. Sometimes there's also things like pulpotomies and pulpectomies and root canals as well. But what to expect, basically when you arrive at our office, you'll check in with the front desk and then have a seat in the lobby. And in a couple of minutes, the operative assistant is going to come out to the lobby and she will talk to you about the treatment today and make sure that you understand everything that's going to be done and answer any questions that you may have. And then she'll take your child back to the treatment room. That assistant will be with your child the entire time they're in treatment. There is never an appointment there alone, and she has a headset on so that she can communicate with the front desk, who then can communicate with you about how your child is doing. And she'll usually keep you posted at different stages of the treatment depending on how long they're back there. Now, you won't be back in the room with your child, and that is for the safety of your child and for the safety of the providers. And it's just kind of like when, if your child had surgery at the hospital, you wouldn't be able to be back there, and that's for the same reason. Kiddos get pretty distracted when mom or dad is in the room, and they tend to not be as still as they are if mom or dad is not in the room because they're trying to look at you to see, what your reaction is, or, just to see what you're doing. So anyway, you will be waiting in the lobby and we'll keep you posted on how everything is going. Now, if your child was to ever become very upset or unable to get through treatment, we don't hold children down. We don't force them to get through treatment. We would let you know right away, and you would either come out there or come back to the treatment room at that time, and we would stop treatment and discuss other options like possibly sedation or something like that. Either that or we would just walk your child out to you. But we don't push them further than they are willing to go in treatment, just because we don't want to traumatize them. We want to set them up for a life of not being afraid of the dentist and having good experiences is a big part of that. Now, that being said, most kids get through treatment just fine, so it's really not something that you need to be terribly concerned with. Once they come back into the treatment room, the operative assistant will place some cream on their gums to begin to kind of numb the area. And actually, first she'll lay your child down so that they can begin watching a movie. They've got a movie playing overhead that they can kind of zone out to. And then, yeah, she'll place the cream that begins the numbing process. And then after a few minutes, the dentist will come in to administer the local anesthetic. Now, that is a shot. It's an injection in their gums of lidocaine or septicaine usually. And it does numb the entire area so that the dentist can treat that area of their mouth and they won't feel anything. Now, as far as the shot is concerned, most kids never know they even got a shot. You got to remember, their gums are already numb, and they're also having laughing gas, and they're zoned out into a movie. So most kids don't even know they had an injection. So we don't let them see it. We don't use the word shot or injection or anything like that in the office. We just tell them they're getting a little bit of sleepy juice, and 95% of kids never see it, never feel it, and it's not an issue. So we do recommend that you don't mention to your child ahead of time that they're going to be getting a shot of any kind. That tends to induce a lot of fear in kids. And when they become afraid, a lot of times they can't get through treatment, and then the only option becomes sedation. So we don't want to put them through that, and we know you don't want to put them through that. So the best thing to do is just don't mention anything about injections or shots. Now, your child will be breathing, in most cases, they'll be breathing laughing gas or nitrous oxide throughout the appointment. And what that does, it doesn't put them to sleep. We don't let them even go to sleep. If they doze off, we wake them up. It just keeps them kind of calm and still and relaxed during treatment. But they're totally, awake and alert and all of that. And then when the treatment's over, the dentist will turn that off, and it clears out of their lungs and out of their systems in a few seconds. However, we do go ahead and leave we have them breathe pure oxygen for 5 minutes, just as an additional precaution to help clear all of that out of their system. But there's no lasting effects. They're not going to be groggy or acting funny afterwards from the laughing gas. During the treatment, the assistant will, after the dentist has numbed your child, it'll take about 5 minutes, and then they'll come back in the room and start treatment, and the assistant will keep you in the loop about how things are going. But it's a pretty fast-paced environment, and we try to make it as quick as possible for the kids. So she's not going to stop in the middle of treatment necessarily to give you an update unless you're really, really worried. But she will let you know when they've had local anesthetic and just reassure you that everything's going fine. So after the treatment is over and they turn off the laughing gas and turn on the oxygen for 5 minutes, then the assistant will walk your child to get a prize, which is their favorite part, and then they'll come out to the lobby to get you. And at that time, she'll update you on how the procedure went and let you know how your kiddo did. One thing to be aware of, if this is your child's first time for treatment, or if they're very young, a lot of kids, most kids do great during treatment, but a lot of times we see afterwards, the moment they see mom or dad, they'll kind of lose it and start crying. And they've been through a lot, and they've been kind of zoned out and not really thinking about it. And then when they see you, something just kind of tends to trigger in kids, and they can get a little bit emotional. So don't be alarmed if that's the case. It's very, very common. Also, your child might tell you when they first see you, they might tell you that they're in pain. It's actually not pain, they're numb, and especially if they're numb for the first time, that's a very odd sensation, and their brains just can't really process it. So sometimes they interpret that as pain. All they really know is that they're feeling very weird. But you can rest assured they're not actually in pain, and the numbing does wear off in a few hours. At that point, they'll be back to normal. Now, as far as after you leave our office, your child in most cases is going to be numb, like I said, for a few hours. So you're going to want to watch them pretty carefully and make sure that they stick to things like milkshakes and smoothies until they get the feeling back in their mouth. Most of the time, like if they have a filling or a simple extraction, most times they're not going to have dietary restrictions afterwards. But depending on the procedures and depending on what had to be done, there might be some restrictions, like don't use a straw. If there are restrictions like that, the assistant or the dentist will go over it with you after the appointment. But in most cases, once they're numb, there's no restrictions. If your child is going to be going back to school after a treatment appointment, we do recommend that you make sure that the nurse and your child's teacher know that they're numb. And what everybody needs to be watching out for is if they have their lip, if they're sucking on their lip or pulling on their lip or biting on their lip. All of those things can lead to major damage when your kid is numb. So you want to be really careful. Make sure that you or somebody else is telling them to stop if they see them with their lip in their mouth or doing something funny with it. A lot of kids don't mess with their lips at all, but we do see plenty of kids it's just a very strange feeling and they kind of can't help themselves. So try to make them not do that because that's really the biggest concern. And most of the time, local anesthetic wears off in a few hours. If we expect that your child's going to be in pain for any reason, we'll let you know what to do about that. But most of the time, it's just going to be taking a little ibuprofen if they're sore afterwards. If you have any questions at all about our treatment and operative appointments or anything else about our office, we would love for you to contact us or visit our website at texaspediatricdentistry.com. Thank you.